Hey guys, Elena here, physical therapist with Great Lakes Pelvic Rehab and Oxbow Health and Wellness. I want to show you a technique that you can try when you're having a first rib pain. Now, if you are having upper chest pain and it is new to you, please go see a doctor right away. That is not a physical therapy issue right now. But if you have had a similar pain before, it has been diagnosed by a medical professional, and it has returned maybe from coughing a lot or sneezing a lot or lifting something heavy. Sometimes I just get this pain when I sleep really wonky at night and I wake up and all of a sudden it just feels really, really tight in this upper trapezius region right here, lower neck. Then this might be for you. So, our first rib comes from the base of our neck, top of our T-spine, and it wraps around and meets up by our collarbone in the front. This rib is attached to a few neck muscles called the scalenes here, which can be overactive when we have a strong forward head posture, or again, with the coughing, sneezing, over bracing to try to lift something heavy. When those muscles get tight and spasmodic, they can twist that first rib or throw it into a wonky position where now it feels more painful. So typically, I would recommend seeing a physical therapist to help ease it back to that nice resting spot in the joint. But if you are stuck in a pickle and you cannot see a physical therapist right away, give this a try. So I'm sitting right by a kitchen countertop here because this is my most common use for adjusting that first rib. Countertop is pretty firm. It's not going to go away from me if I push up into it. The goal is that as I push up into it, it pushes my first rib down and maybe forward just a little bit. Just not going straight down, just in a little bit, almost in line with my shirt there. Because this is a firm surface, I use some sort of cushioning, like a folded up towel. So it goes between me and the countertop. I have the pressure right on the painful spot. It will feel tender. That part's normal. Okay, so you're going to think about tilting your ear towards the painful side. You're going to put a little bit of pressure from your hand on your head. You're trying to push into your hand without moving your neck. So keeping the pressure there, you're going to do a nice big inhale into this space and exhale, push up gently into that countertop, maybe about half a pound of pressure. You don't need to ram on it. With the next inhale, you breathe up into that space, and then exhale, push up with your feet or your knees so that you get a little bit more pressure right in that space. Still put a little bit of pressure in from your hand or your fingers here. Deep breath in, and exhale, push into that countertop. I do this for between 3 to 5 breaths. It might still feel tender afterwards, but it should feel less painful or twingy when you go to look up or you look to the side. That's your good indicator that it's doing what we want it to do. In the meantime, work on a lot of scapular strengthening and postural strengthening. If this doesn't work for you, please see a medical professional to get more help. But hopefully this helps you in the short term. Good luck.